Whipple's disease is a rare and hard-to-diagnose bacterial infection that most often affects the gastrointestinal system, usually centralized in the duodenum and small intestine. The colonization of Trophorema whippleyi, which causes the disease, interferes with normal digestion, including the breakdown of foods such as fats and carbohydrates, therefore impairing the body's ability to absorb nutrients. When recognized and treated, Whipple's disease can usually be cured with long-term antibiotic therapy. Untreated, the disease is ultimately fatal. The cause of Whipple's disease is the multiplication of bacteria called Trophorema whippleyi, or also called T. whippleyi. But scientists are unsure how T. whippleyi infects people. There are many theories, but none have been proved. The most supported theory is that some people are more vulnerable to Whipple's disease because of genetic factors which influence the body's immune system. This theory is supported because there are a relatively high number of asymptomatic carriers. The bacteria are also much more common in the environment than would be predicted because of the rareness of the disease. Finally, no documentation exists of a person-to-person transmission, aiding this theory. The signs of Whipple's disease that are external or measurable are weight loss, diarrhea, abdominal bloating, fever, anemia, which is a lower than normal number of red blood cells, and also inflamed joints, particularly the ankles, knees, and wrists. Internal signs that can only be seen through endoscopy, biopsy, or surgery are internal sores, also called lesions in the intestines, thickening of tissues, and finally, the villi, the tiny finger-like projections that line the small intestine, can take on an abnormal and club-like appearance instead of their normal appearance shown in this picture. Some less common signs include cough, enlarged lymph nodes, skin darkening in areas frequently exposed to the sun, discomfort while breathing, enlarged spleen, and heart problems such as heart murmurs. Some common symptoms include abdominal cramping and pain, which worsens after meals in some cases, fatigue, and weakness. Some neurological signs and symptoms include difficulty walking, visual impairment, seizures, confusion, and memory loss. The diagnosis of Whipple's disease consists of 3 steps. The first step is a physical exam, where the doctor examines the patient looking for abdominal tenderness, fever, skin darkening, and other signs and symptoms. The second step is a biopsy. A tissue sample is taken from the small intestine through an upper endoscopy, which is the use of a thin flexible scope which passes through the mouth, the esophagus, and the stomach to reach the duodenum, jejunum, and small intestine. During the endoscopy, the doctor can examine the inside of the intestine before and while taking the sample. This is a picture of a healthy intestine, and this is a picture of an unhealthy duodenum taken in an endoscopy. This endoscopy picture shows abnormal folds in the duodenal wall, which hints to the presence of T. whippleyi and would show the doctor where to take the sample from for the biopsy. This biopsy shows the presence of abnormal folds in the duodenal wall. And this biopsy from a jejunal wall was tested to show the presence of Whipple's disease and T. whippleyi. The third step that doctors use is blood tests. These are used to check for anemia, a complete blood count, and low concentrations of albumin, a protein in the blood. One or more antibiotics are used to destroy the T. whippleyi, which injure the intestines in such a drastic and dangerous way. The treatment is very long, however, because the T. whippleyi bacteria is persistent and very hard to completely eradicate. So, antibiotics must be taken for as long as 2 years, even though symptoms subside as soon as a week or two after the course of treatment has been put in place. But if the duration of the antibiotics is shorter, or the patient's body develops a resistance to the drugs, relapse is common. Antibiotics used for standard cases include 14 days of intravenous ceftriaxone, otherwise known as Rocephin, and a 1 to 2 year oral course of trimethoprim sulfamethoxazolone pills. Antibiotics used for severe cases which affect the nervous system include a 12 to 18 month course of oral doxycycline combined with the anti-malarial drug hydroxychloroquine, otherwise known as Plaquenil, and again a 1 to 2 year oral course of trimethoprim sulfamethoxazolone. The prognosis for patients whose Whipple's disease only affects the gastrointestinal tract is good. They recover completely from this disease after a full course of prescribed antibiotics and frequent checkups with their doctor. But when patients also suffer brain or lymph complications, the possibility of relapse is a threat for the rest of their life.